Hello, everyone. Thanks for joining us today. We're going to get going in about one more minute here. All right. Good afternoon, everybody. Thanks for joining us today. My name is Andy Simmons. I'm the VALT Education Specialist here at Intelligent Video Solutions. I'm joined by two customers of ours for a live discussion on how they use mobile recording in their facilities. Let's go ahead and add them to our screen here. And I'll do some quick introductions of who we have. But first, today's conversation, it was spurred by questions that came to us following our webinar on our Beam application that we put on a little over a month ago at this point. And a quick side note, if you were on that webinar or if you watched the recording afterwards, if you couldn't catch everything that I was showing due to my home internet technical difficulties, I apologize for that. I did re-record the webinar. I put it on our wiki for your viewing. So just log into Vault, click on your profile in the lower left corner, click on the help icon, and then select the wiki, and you'll be able to find the recording that I put on after our actual webinar. And then it's also where I'm going to put this recording when we're completed with it. Okay, so we'll get right down to business. And I'd like to introduce our two panelists for this discussion, both from Missouri State University's McQueary College of Health and Human Services. First, we have Dr. Monica Feeney, the director of School of Anesthesia. And thanks to Dr. Feeney for filling in for us sort of at last minute when our original panelists couldn't make it. We're glad to have you here.
Yeah, no worries. Thank you. Pleasure to be here.
And then we also have Ian Alaimo. Ian's the director of Information Technology and Operations. So to summarize, we're joined by a healthcare professional / educator and a director of IT. So although they both come to us from the same institution and they work closely together, they approach technology and mobile recording from two very different perspectives. So I'll plan on just asking the two of you both the same handful of questions, rotating kind of who goes first and second. Some of the questions might not apply to both of you because clearly, Ian, you're in IT, but if you can give your perspective on those as well, that'd be great. I may ask a few follow-up questions for things that spark interest, or if there's something I don't understand because I don't live in the same world that the two of you do. But we'll go ahead and get started with a nice, easy one, and I think we'll start with Ian for this one. If you could just give us, a 1 or 2 minute intro, who you are, what you do at Missouri State.
Sure. So as Andy mentioned, I'm the director of IT and operations for Health and Human Services. Started out as a student nearly 30 years ago and just never left. So kind of worked my way up.
I asked you to come here.
Yeah. Excuse me. Yeah, so I kind of oversee IT at a higher level and over a lot of projects, whether those be IT or a building or anything the dean and the school directors want. So it's kind of a little of everything. My team's grown to 7 people, 7 full-time folks, and some GAs and students that help out as well. Recently, we moved one of our simulation labs over to the college level, so I oversee that as well. And so have a direct involvement with VALT and its implementation.
Great.
I think that
Monica.
covers it.
So, hi, I'm Monica Feeney. I am a CRNA by profession, which is a certified registered nurse anesthetist, and practiced for many years, and then became an educator. And I've been at Missouri State 11 or 12 years now, and just actually, we've used several different types of video systems, and VALT's one of my favorites, and simulation is really a love and passion of mine. But yeah, I've been here as an advanced practice nurse for a lot of years, more than I'll share, and been here at Missouri State, like I said, for about 12.
Great. So the point of this discussion really is about mobile recording. But before we get to that, I do want to just kind of start at the recording level and just say, like, how do you use the recorded video or live streams in your department? So forgetting about like what device is actually doing the recording, how do you use the footage that you actually captured? Since this one relates more to Monica, we'll start with you, and maybe in this case, just you.
Yeah, sure. So we are a doctorate level program, and so we use them for benchmarks and for testing because we are not at a hospital right here at the university. And so the students, firstly, they can learn skills, and we record them, and they can also watch them and watch what they've done correctly or incorrectly. And then we do also not only evaluation, learning firstly, and then also evaluation with the recordings. And we also keep records of right now we're going through the end of semester evaluations. And so I have a recording of each of the students where they are currently, and we do it at least 4 times. So every 6 months, so they can see their progress. And also we can see that they're progressing as they should be. And the nice piece of the recording is we can go back and show them, or if there's ever an issue or a problem, it won't be, no, I didn't do that, because we can say, oh yeah, look right here. And but we try to use it not as anything punitive, but as this is a good thing and to teach you to be a safe provider. So we use it actually quite a bit.
Can I ask just kind of follow up there? This might be like the first experience a lot of your students had, like being recorded and reviewed that way. Is that an accurate statement?
Yes, yeah, it is. And actually, I was surprised at first. They are so tech savvy. They like it and they don't mind at all. Now, the more, so we do it, we use it before they even go out to take care of actual patients. And so they enjoy that part after they've been out taking care of actual patients and they come back to the lab, for example. It's a little bit different because they already have some real world experience, but they think it's cool. So they're all about, any kind of technology that they can use or do. They've enjoyed it so far.
So maybe more of a shock for the educators than the students. Ian,
Yeah.
I don't know if you have anything else to add to that question about how the actual, recordings and streamings are used from an IT perspective. Any thoughts on that question?
Yeah, sure. Excuse me. We have a speech language pathology clinic, and they use it a little differently than how Monica does, where there's a kind of a preceptor, faculty member, and then a graduate student typically with the patient. So the faculty member is watching the live stream and making notes on VALT. We moved from a fixed camera system over to Beam a couple years ago, just for the flexibility and kind of moving around locations. And the students go back and they review the video, as Monica mentioned, and see what they did wrong or right, and kind of have a review session with that faculty member. So we use it in that regard, and then also in the simulation labs, we record every session just for kind of posterity, and if any questions come. We've had a few incidents where a student was maybe upset or didn't get the grade they wanted or something, and it's really handy to have that recording to go back and review. Typically we go through the server and get rid of those recordings every year, but we try to keep them for at least that long.
So you kind of mentioned on this, but we'll start with you on this kind of third question here, is why you decided to go the route of mobile video as well. Mm-hmm. Can you maybe touch on like that decision? What were the objectives that you were trying to accomplish that maybe you weren't able to do before that?
Sure. Yeah. A lot of it was, the flexibility, like I mentioned, and then also the camera views. Typically a network-based cameras, in the corner of the room, and that speech language clinic has a lot of young children in it, and they really wanted to actually get clear audio, and they wanted to see the face and how they're speaking, and it was kind of hard to get those views from in the corner of the room. So we bought iPads, which are fairly inexpensive. I think one of the first areas to switch over to Beam. We put those either on a wall mount or a tripod, and we can get that view that we need, and picks up audio really well. So those were the main reasons. And then it's also been beneficial because we're going through a lot of construction at the university, and we're having to move clinics around to different locations while there's remodeling. So we don't have to install a full-fledged network-based camera system. We can just literally pick up the iPads and use them anywhere, as long as the Wi-Fi is good.
Great. And Monica, can you add to the use case that you were looking for? I mean, he touched on how you guys were already looking to use it, or at least in the speech path, but how about in your world?
Right. And so we kind of tagged onto that. We initially started out with all the fixed cameras as well. And then when we realized we could have a mobile camera, how cool is that? Because what the students can do with that is we can do skills testing. And so, for example, we teach about the anesthesia machine, and the students have to show us a checkoff. And so the students can check out the iPad, and they do the checkoff themselves, and then the faculty can grade it at any point in time that they want to. They don't have to be right there one-on-one 48 times with a different student. The students can do it, they can redo it. And so we've done those checkoffs for years, like I said, one-on-one. And now the last year and a half, we've done it mobile, and it has just been incredible as a time saver, first of all, for the faculty, and they can grade it whenever they want. And the students can also do it whenever they want. So that's how we use it. And I know nursing also uses it as a skills checkoff, so that, start an IV, you can show how you do it on a fake arm, or if you're doing other things, and the faculty can check it off later. So great teaching tool. They watch a video first and then they record themselves doing it. So it's been really useful for that.
That's great to hear, because I think a lot about the things that Ian said, which was, like the ease of, just bringing the iPad to a new room and, things like that. But I really think about like the fact that it actually, saves you time, the actual efficiency behind it. That's great to hear.
It was it was a great opportunity too, in nursing, to be able to use it in a different area than in the sim lab. So, we have 5 hospital rooms, but maybe we want to use a clinic room, and now we can do that because we can just take that little mobile thing over there and show it. So I think that increased our ability to do things exponentially, not just by, if you have one iPad, by one, but really amazing, actually.
Sure. And I swear I'm not trying to push Beam. We just having a conversation about mobile recording, but it's nice to hear that you can use your permanent cameras along with the mobile solution and have just like those additional views. How about if we go to so you made the decision to use mobile, but what did the implementation kind of look like? Were there any unexpected either challenges or successes? So basically, in other words, kind of what did you learn along the way? And we'll start here maybe with Monica. Tell us a little bit about when you first decided as a department, like, hey, this is the route we're going to go.
Well, I don't, really, he has not paid me to say any of this stuff, but it was really, it was really easy, shockingly easy. And my sim lab coordinator, gets the iPad, he uses it, and the students picked up on it quickly. Implementation was just really easy, very, very easy, especially if you're used to a fixed system. If you're not even used to a fixed system, I feel like it would be even easier because you don't need to do all the setup because you have it right there in front of you. So from my end, it was really easy.
Wait, you think it would be easier if you weren't already using a fixed system?
Yeah, probably. You just have an iPad. Most people are used to mobile devices. And so it's like a larger mobile device, a larger movable camera. And then, even if you don't use all the bells and whistles that it can do, it's very easy to record, re-record, save, those things. Yeah.
Ian, how about from an IT perspective, actually implementing this when you guys decided, okay, we're going to get, licenses to use Beam, or really if anyone's using any mobile solution, what was that implementation process like for you?
Sure. People really get excited about the mobile, the iPads. I don't know why, but you talk about a fixed camera system and you just don't get a whole lot of excitement there. But, we've shown these iPads to physical therapy and occupational therapy, and they've all kind of bought in. And like I've said many times, love the flexibility and be able to, move those around as needed. Implementation was a little difficult at the beginning because I think, like I said, we were one of the first people to go to it. So just the typical, getting familiar, rolling it out. The server side, the back end of it, takes a little work to figure out, but it's a competent IT person can definitely, do that. And then we've also kind of set up a test system. So we're not, implementing changes in a live environment. So I think that's been important to where you're not making changes that can, impact the clinic. You can kind of try those out prior. So yeah, that's kind of how we approached it.
We were not one of the first users of it. We were using it after they worked out all the kinks. So that's why I think It was for us, because they had it already going smooth and we were like, yeah, we can use this. So.
Right. And I think we've had it.
A different department within the school using it first?
Yes. Like speech and audiology had it first. And so
going back,
it's been seamless since then. I was just going to say we haven't had problems now. It was just kind of as was rolling out. So we've been on it 2.5, 3 years, I think. And, really the main issues are, with the iPad itself, or maybe wireless. Those are the biggest two things that we find, but those are all, normal IT things. So really nothing to do with the Beam or the mobile side of it.
So then, Ian, going back to some of those things you said you were hoping to accomplish, more views, you mentioned efficiency. There was what was the other goal you said you were looking for besides more views?
The flexibility maybe, or
sure. So were those goals then essentially accomplished? Like, did you were you able to meet the objectives? Right.
We were. Another big pro is the efficiency. That means time. It means money. Our networking team here is very busy, just like everywhere. So the amount of time having to wait to install a network drop or mount a camera and get those all configured, we're able to just move an iPad from an adjacent room and be up and running. So I feel like that was very beneficial as well. Just being able to do it ourselves without relying on other teams within the university.
Sure. Monica, how about you? And I feel like the answer is going to be yes, that you did meet your objectives based off of your last answer. But can you talk a little bit more about your goals beforehand and if those were met, and just kind of current state versus past state?
Sure. We're always trying to be more efficient with our time, and so I feel like we didn't even realize the amount of time that we were spending and how much it saved us until we saw the mobile option. And because we were trying to make everything work. And, when you have fixed cameras, it works good for an OR because the OR bed is in a fixed place. But when you're talking skills learning and other things, it's so much more mobile and so much easier. And just like I said, the time savings on for the students, because they don't have to wait their turn, they can do it whenever they want to. And then just for the faculty grading and getting feedback to the students in a timely manner, it's just been a huge amount of efficiency and time savings, I feel like. So
Great.
No downside, really no downside to it. So
I was just going to say another use case is, not intended really, but we use fixed cameras, some of the cameras on these mobile carts with extendable arms, and the mobile iPads within anatomy labs. We have like 4 anatomy labs over here, and they're used extensively. Partially because they can get that view that's really zoomed in and crisp that you can't always get with a fixed pan tilt zoom camera. A lot of times a person's in the way and they're doing dissection, and you can really get in close. Another thing is if we have those labs open after hours and have students using them without maybe direct supervision, you can actually get on the system and observe them to make sure nothing is going wrong, and go back for, it's almost the security side of it, which we found in a few cases has been very beneficial. So.
It's great to hear.
Yeah.
If there was, if there was either another department within your school or maybe another organization entirely that was considering implementing mobile recording and streaming to their workflow. So maybe they either don't have any video system, or maybe they're only using, permanently installed cameras. What types of suggestions would you give to them, either for implementation or for, continual use? And I guess we could start with Ian, because, you talked a lot about the implementation and some of the IT, struggles and device struggles. So if you were to kind of advise somebody who's looking to go this route, what would you tell them?
Yeah, I would make sure you have, someone that's competent with server administration, and, get the right hardware. You want as much storage as possible and as much memory, and obviously you future-proof as much as you can, but that's something that would have to be probably replaced every, 5 to 8 years, I would say. Also looking at all the different options. I think Beam is the only one we found that was really reliable and on the mobile side. So, but I think you do your comparisons, and more than likely you'll probably end up back at Beam. But that's, we've talked to lots of other universities, and they've come and seen our setups and gone back and asked for further demos, and most people that see it are really excited and think it's a great tool.
Great. Monica, how about from like an end user perspective, someone who's actually getting used? You said it was pretty easy to implement from students using it if they wanted to use it, but even still, if you could go back and redo it, or give another department some advice on how to best utilize a mobile recording solution, what would you tell them?
So I feel like we need to think outside the box, and if you need a video solution for something, it's so nice to have the ability to be flexible, so that you're not limited by space, and it actually not really limited by time. And so it just gives you so many more options. And, you need to have people, though, that are flexible and that like technology, that like a video side of it. And some generations are not as friendly, we'll just say it like that, towards that. But the younger generations are very much, like I said, phone savvy, tech savvy. They like that kind of stuff, and they can come up with even more ideas of how to use it and what to use it for. So, if I was talking to another department, any department here, it's like, what kind of things are you doing in your program, that you need a record of, firstly? Because now instead of having a written record, maybe you can have a video record, and how much more engaging is that for teaching and for learning and for evaluation, and what a great record than a piece of paper. So those are the kind of things I would tell them.
I love hearing that, using the video for learning, not like of learning, not always using it to evaluate, but using it to help aid their learning along the way. That's really nice to hear. So for either of you, I guess really the last question I have is what else is there anything that I missed, or any important aspects of Beam or just mobile recording in general that we didn't talk about in this discussion that you'd like to address?
I guess one of the things we haven't touched on is how it doesn't have to be a full mobile solution. We've found success in the simulation labs where it's an additional view of a room. With VALT, you can have up to 4 views, I think. And, 2 of those might be fixed cameras. One might be kind of a screen capture of some sort, and the other one can be a mobile view of, a very, very tight shot or somewhere that the camera can't get. So I think having a blend there adds a lot of benefit as well. The other thing we've really started to use more and more is the notes feature, and the timelines have definitely improved in the newer versions, and we're excited to kind of see that progressing, and we're starting to use that for checkoffs and evaluations, and having that built right into VALT with kind of the timestamp is phenomenal. That's very, very helpful. You don't need a separate software package, or in the past someone would have like Microsoft Word pulled up and putting their own time and notes in there, and having that all built in has been great.
Yeah, I do think we probably think a lot about solutions like this as either permanent cameras or mobile. It's right. Nice to hear that you're able to kind of have the two work side by side. any learning curve there that you had to deal with? Like, a person with an iPad moving around the room while you have your cameras going or anything like that?
Not from the user standpoint, and from the IT standpoint, it's very simple. It's you just name it, a room or a department, whatever you want to call it, and then you add the devices to it. So you can change that in the fly as well. You can have, okay, this room today has 2 fixed cameras, a monitor capture, and 2 iPads. So it's allows you to kind of plan what views you want beforehand, and supplement that with extra devices.
Great.
And I would even
Monica, any
say,
other thoughts?
I would say if you can only have one because your budget can't afford both, I feel like we're really blessed to be able to have fixed cameras and the mobile cameras. I didn't even know about the mobile cameras when we had the fixed cameras. And so, if we wouldn't have had anything, I think I would have gone for the mobile ones because I could do more with, I could take it more places with me. And so I think they're just an amazing addition and have so many uses, even that we haven't even come across yet. But that doesn't mean I want to give up my stationary ones. But like I said, if I only had the budget for one, I think I could do it with that flexible one. No matter what, I could make that work. And so it's a great option and alternative if you're limited on what you're allowed to spend.
Yeah, I guess that's another benefit, right? That we talked about in the webinar last month was like, if you just don't have the funding for those PTZ or fixed cameras, it's always an option.
Yeah.
Okay.
Another benefit is we've had athletic training use it in areas that didn't have Wi-Fi, outside the building for some scenario, and you can record locally with Beam, and then when you get back to a network, just upload it there. So we found a few use cases where that's been very helpful.
Yeah, no, good point. Like, we talked a lot about using it in the room with your other cameras, but if you have to leave that room, you still have that option, don't you?
Okay. Yeah.
All right. Well, that's all I have for the two of you today, and we're kind of right on time, so I'll end it here. Thank you everybody for joining us. Thank you to our friends from Missouri State. I really appreciate you today. If anybody has any questions on Beam or mobile recording just in general, feel free to give us a call. Otherwise, we'll end the recording, and I'll put this on our wiki if anybody needs to view or share this at a later date. Okay. Thanks, everybody. Have a great day.
Thanks,
All right.
Andy.
Thanks.